For joining. Um, it's a pleasure to welcome all of you. And we are about to start our second Science Wednesday event. And this is hosted by the Com Collaboration, of course, and tries to improve collaboration amongst members of the Com Collaboration, but also osteopathic researchers. And I'm very happy to announce our speaker for tonight, which is Francesco Cerritelli, who's, as you all of you, I think, know, is an osteopath and a neuroscientist and the president of the Com Collaboration and an assistant professor at the New York Institute of Technology, and also personally one of my favorite osteopathic researchers. So I'm very happy to hear his lecture on the topic of identifying gaps and future directions in osteopathic research. So without further ado, a warm welcome to Francesco.
Thank you very much. Thank you, Lucas, and thank you, Nuria, for creating this very nice event. What I would like to set the ground and the floor for today's presentation is regarding the fact that you can stop me anytime that you want. Okay, so just making that rather than a one-person lecture, more a discussion way of identifying gaps and future directions. Okay, so how has been structured? I don't have any conflict of interest in this sense. And I need to acknowledge the team that helped me to create all the bibliometric research and data that I'm going to present here. Some of the data, updated data from also a previous presentation that I made with Jerry in Copenhagen. So Jerry, there will be some of the slides, at least the outfit of the slide that might be similar. So the goals would be to give an overview of the scientific literature on osteopathic manipulated treatment, identifying strengths and weaknesses, discuss the impact of osteopathic research and open possible further developments, and of course collaboration by identifying which are the areas that might be interesting based on the impact and benefit that we want to take. So that is the global overview. This is in the last 25 years. So mainly started in the Anglo-Saxon region scene. So US, UK and Australia. And then in the last 10, 15 years, actually more countries came along. And here we are just counting the cumulative numbers of research that has been published. Okay. Up to now, we are pretty much around on PubMed around 2,000 records, and considering also the Scopus, probably slightly a little bit more. Now, among these conditions, this is the trend of the last the last 25 years regarding the number of research divided by study type. And with actually we had a significant peak before around COVID, and then actually it goes in terms of the number of studies slightly going down. The data of the 2025 are updated up to June, end of June. So it's actually half a year. So this is the so how we can look at the quality of data. We know, and actually also there were published beautiful research regarding how to assess the quality of research. Now, in this context, we took into consideration the quartiles. So where actually the studies were published. And you can see that the amount of studies published on the first quartile actually increased throughout the 25 years, as well as the second quartile. So there is a kind of increasing idea or increasing attitude for osteopathic research, at least to point towards the first and the second quartile. Now, this, of course, it doesn't mean probably nothing. It doesn't anything, but at the same time can give us the idea of to where the attitudes of research is going. If we put together the quartile one compared to the non-quartile one, it's here you can see that pretty much the 20-25% of the entire research is published over the what it actually is required for university to be a good journal, because the majority of the university, when actually we look at their requirements, actually they are requiring substantially Q1 publications. In addition to that, the Q1 condition is also one of the main elements that actually is taken into account for grant funding. So it's also essential for the attitude of calls in order to identify good research. So that is pretty much what actually we've been talking about. On average is the 25%. In the first 6 months of the year, 2025, actually we have a interesting trend in terms of increasing the number of publication over quartile one compared to non-quartile one. But I mean, further data, not entirely sure that this is going to be a significant, a stable trend over the entire 2025. So that is looking at the number of publications in quartile one, and then we can see the distribution in the last 25 years, where the majority at this moment, back in the days, were over UK and US. And then in the last 10 years, actually, the trend came also over our other countries, so Australia, Italy, Germany, and France. So that is the distribution over the different nations, but with a pretty much substantial spread distribution across the different nation. That is globally, so with US as well. And this one is only related to Europe so far, where the percentage of the quartile one publication is slightly higher compared to non-European publication. And that is in terms of percentage. Of course, there will be countries where the publication are very, very few, or even one, where actually, for example, Ireland or the Czech Republic, where actually there is only 1 or 2 publication over quartile one. That's why actually you can see there is 100%. So, but looking at those nations actually published more. The distribution is pretty much similar to what we said earlier, with a distribution around the 25, with the range between 25 and 40%. Now, if we again look at the old style, let's say, view of the quality of publication, we need to look at the RCTs over the quartile ones. And here we have very few RCTs published in quartiles one in the first decade of 2000, from 2000 to 2010. And then the number of publication in the last 10 years actually increased quite significantly, giving in particular a big push from Europe. Compared to other countries. And this is the distribution of the type of studies, RCT and non-RCTs. And again, we have a important attitude towards the non-RCT studies, which includes the observational studies, case report, systematic reviews, so systematic scoping, narrative, whatever. So everything that is not interventional studies actually has a large, let's say, attitude. The osteopathic research has a large attitude in publishing non-RCT studies over the 80%. And that is, as you can see, it's pretty much constant throughout the last 25 years. Regarding the areas of intervention, and this is in terms of general, so globally, the musculoskeletal and medical education are the most representative. So sorry, this slide is very long. So this graph is very long. So I need to chunk down into 3 pieces. So we'll be seeing 3 slides. And so from the top, there are those who were published more up to the all the way down to very few publications. So musculoskeletal and medical education are the 2 topics most common to be published, and then there is the areas around the nervous system and the brain, in particular in the last 10-15 years, as well as pediatrics, and chronic pain is significant increase. Now, that is one of the elements that might open some discussions in terms of, in particular, the clinical condition that have been let's say, regarded as with a multidisciplinary approach, and where actually the osteopathic treatment might deserve a place, both as a complementary therapy and or an adjuvant therapy to the standard care. And indeed, we can see that, for example, the speech problem, nose here, and headache, the sports, the equilibrium balance are all areas that have been explored very poorly, but at the same time might have something from a clinical perspective that might take some consideration and some element into the discussion. Why is that? Because if we take the clinic, so our clinical condition and the people that we see and the patient that we see in our clinical practice, definitely, yes, it's true that we have musculoskeletal problem, but we have also other problem and other disease that my disturbances that were not sufficiently studied, and at the same time actually have particular interest into the clinical practice. That is the case, for example, of pregnancy. This is the case of prevention, temporomandibular problem, public health conditions, and of course also the economical impact of that, or feet problems. So we saw briefly what actually is the current situation globally, and if we zoom in into an EU overview, and why Europe, because it is the continent where in the last 10-15 years there were the most probably most high quality publication. So that is what happened in Europe in the last 25 years, where the predominant activity of UK, and then the rest of nation actually came along in the last 10-15 years so far, with particular interest from Italy, Germany, France, and roughly Spain. This is the same condition in terms of, same condition in terms of Q1 publication. Also here, there is the majority in the first 10 years of 2000 by UK, and then all the other nations actually get aligned to the attitude of publishing on between quotes higher impact factor journals so far. Um, that is the number of RCT. Not many. Again, in the first 10 years of osteopathic research from 2000 2010, there was a slightly increase between 2010 and 15, and then there's a significant increase from 2015 onwards in the last pretty much 10 years, where Italy made a significant difference on that sense. And those actually are the distribution again of the different topics. Also here confirm the fact that musculoskeletal problems are the one most researched. But as compared to the globally, there is no medical education, but there is more pediatrics and then research on brain activities, nervous system, autonomic nervous system, and so on. So why is that this difference? Because the majority of the publication globally were, of course, made by US doctors, and the majority of most of the publication that they do is mainly related to medical education. And that is the distribution of the number of studies based on topic and classified by nations. Now, in this context, one of the things that make actually these pictures help us to discuss which is the current situation up to now, but also which might be the future of possible interesting areas of interest, bridging these two elements that actually research, the research and the clinical practice. Now, in order to make these element real, one of the possible strategies we can do is look at mechanism of action. Now, this one is a table that actually I have summarized the main, very briefly and very concisely, the different effect of mechanism of action based on domain, so autonomic regulation, pain modulation, immune response, and so on, and the mechanism of action has been proven. So we know that there is an increase on parasympathetic tone and decrease on sympathetic output, giving the fact that there might be also a preganglionic cholinergic effect, which has been shown by a paper that we published a couple of years ago. Then there is a pain modulation, so a reduction of central sensitization, and using and remapping the pain metrics in the pain network. And also there is an idea of endogenous analgesia made mainly by a paper that hopefully will be published soon, that we analyze the effect over the thalamus and the projection of the thalamus, and measuring the neurotransmitters. And actually what we found was a clear activity of the opioid system as compared to the cannabinoid system. So it seems that also from the fact that actually we are going into a reduction on pain and a reduction in central sensitization seems to be related to the opioid system and on the cannabinoid system, starting directly from the projection of the thalamus. And the less pro-inflammatory cytokine actually has been discovered several times and then proven several times, as well as a fascia biomechanics, so fascia remodeling towards an hypothesis of improved tensegrity. There is a resetting of aberrant somatic reflex arcs, and those are more neurophysiological data, as well as lymphatic and visceral flow, both in humans and also in animals, HPA axis regulation, so reduction of cortisol, improved metabolic parameters, and of course, remapping of the cortex in terms of proprioception, more precisely on sensitization, and also the sensation of and the sensing, remapping of the sensing input based on an active system. So regarding the brain, so it's been initially some of those elements are proven several times with several publications. Some of others actually start to be hypotheses and just a first data in regards mainly on the brainstem. There are more consistent data regarding the cortex and the proprioceptive stimulation with a sensory reintegration and better motor control. In particular, also related to the pain and in particular to low back pain. The thalamus, we talk about the thalamus with the pain matrix modulation, where the anterior cingulate cortex are element extremely interesting for remapping interoceptive condition and the aspect and the element of let's say and the emotional element regarding on pain. Prefrontal cortex, in particular with the limbic prefrontal network engagement, so improving better focus condition and improving also the ability to detect the silent stimuli, in particular related to the orbitofrontal cortex. And then there is amygdala, hypothalamus for improving autonomic and interoceptive feedbacks, and the ventricular system with the sinus drainage that can be also, this is a kind of more an hypothesis rather than a established condition. Now, having the impact over the specific clinical condition and having also the idea of how the mechanism of action might act generally. So what actually is the effect and how we can look at the effect of osteopathic research and the impact of osteopathic research. So here we have two big pillars. The first one is the public health impact, and the other one is the private health impact. With the public health impact, definitely having a clear strategy regarding research, a clear strategy regarding what the mechanism of action are, and a clear strategy where we should go based on the bibliometric analysis, then we might impact policymakers, like the different guidelines has been published several times during the last 15 years. So we can prospectively give data and support the data regarding how the policies might change based on quality of research. And that is why we use also the analysis on Q1 and RCTs, because the majority of the paper that has been used here actually are Q1 RCTs. On the other side, there is the public sector. Now, the public sector is not, I mean, in non-US country, actually, it's important in regards to the possibility of being part of, for example, hospitals, like happened for the RACE project. And actually, I put the RACE project because we are in the period of the RACE weeks from the 17th of December, the 17th of November, so the World Prematurity Day, up to the 3rd of December, that is the World Disability Day. And during these weeks, actually, we promote the activity of osteopathic treatment also through the activity of different hospitals where actually we are working on. So it's a way of increasing the awareness of the impact of osteopathic research into the public sector. And how we do that? Thanks to the data coming from research. And data coming from research says that the use of osteopathic treatment just briefly get a saving for the hospital. In this case, 3 hospitals with over almost 700 preterm infants treated, with a total saving for the neonatal intensive care unit of $500,000. Sure. Okay, I'll sorry. Can I answer after Paul? Thank you. So The other scenario is related also to the impact, so the economical impact. And in this paper that actually Patrick Van Dom was part of with the HEVO project, actually they, for the first time, they look at the economical analysis of osteopathic treatment, and that is the very first example of high quality research looking at the cost effectiveness and cost utility of the osteopathic research. Making a clear example of the effectiveness in terms of economical analysis of the osteopathic treatment. So, in synthesis, the what actually they claim is that the economical evaluation studies show that base case, so osteopathic care was found to be a dominant strategy for low back pain and a cost-effective one for neck pain. So therefore, using different ways of analysis so far, and also using also different way of analysis, actually they show also cost effectiveness and cost saving findings, and as well as with more specific analysis with sensitivity one way analysis. Actually they also they also demonstrate that actually the osteopathic care cost as an input parameters having most influence on the clinical outcomes. So that, why is that? That actually are in all elements that are important for the public health sector. And why are important for the public health sector? Because actually they might change and they might modify and they might influence, they might get the discussion open over the clinical governance and the evidence-based healthcare. So based directly to the hospital and the regional healthcare condition, and on the other side to the clinical governance, so the ministry. And so the healthcare organization that actually are responsible for continuous improvement of quality of services. So those are elements that we need to take into consideration, in particular when we talk about the impact that we and the impact and benefit that we might have. But this condition, it's also related to the fact that actually we can use osteopathic treatment into public health sectors. There's several papers that we've been published during the last 6 or 7 years with a project directly, with the RACE project directly in the hospital, in particular with the preterm infants. But why it's important that? Because if we look at the Greenberg analysis of healthcare health service research, so we might have different domains and elements that actually we need to take into consideration. And when we think to plan a research, we need to have a clear idea of where should be the benefit. Should be the benefit to only the treatment of disease that might be only very small condition, or might have an impact over the local microsystem. That could be the hospital ward, the hospital unit, might be the nurses, might be the relationship with the and the collaboration and multi-professional collaboration with a small group of practitioners and professionals that actually are within the unit or within different unit in different hospitals. But at the same time, we might have a vision that is related to the healthcare delivery system, so that might influence health policies, might influence pay reform, and therefore all the other elements that actually are related to the governance rather than to the clinical impact. And these actually might create what actually the core of the health service research, where the different systems and the different domains, so the health delivery system, the local microsystem, and disease management actually are merging together. where in terms of its coverage decision, technology cost effectiveness. So we're looking, for example, at the intercept between healthcare delivery system and disease management, or if we look at the safety, patient safety, we look at the domains really related to the disease management and local microsystem. Or if we look at the unit, so the hospital, based on the healthcare delivery system, we look at implementation science. So how we can implement it and reproduce that specific, let's say, clinical scenario in more than one hospital world. So that is in brief what actually is taken into consideration regarding the public impact. The private impact, there is also a private impact that is related to not the corporate so far, but is related to the clinical condition. So how we can improve the private sector based on research. In the I have put this picture for the 2020 paper, because actually there is the idea of using artificial intelligence and machine learning and the head-mounted glasses in order to improve the perception of the patient directly during the treatment. So we can influence the sensory condition and sensory control based on manipulating the virtual environment. So with the virtual system. But that means that with research, actually, we can also create information for better local clinical offices and create, therefore, a healthcare system that might benefit of all this research, in particular with the PBRN, where actually here we have a phenomenal representative with Jerry that actually he established a PBRN, so a practice-based research network in UK. So, and then might have benefit with single osteopaths, but at the same time, this actually has pros and cons, because the majority of the osteopaths actually might have difficulties in translating what actually has been published, has been written in research into the clinical context. And I think that is one of the main areas of improvement that where we can see collaboration and eventually potential benefit for the osteopaths that are not that much into research. Why? Because actually they are improving what it's called the clinical experience. So with research evidence, the patient values and expectation, and individual cases expertise. But so in this case, if we have a clear strategy, we have a clear vision, we have a clear future vision, of course, the collaboration with other healthcare professional might be extremely easier. Why? Because then we go into the fact that we are moving from evidence-based practice, where actually the single osteopaths we're talking about, into evidence-informed practice. And the evidence-informed practice is the process by which the three domains that we talked about earlier, so individual clinical expertise from the osteopaths, the knowledge regarding the research evidence, and the patient values and expectation that actually are making a clinical experience, needs to be also improved by the healthcare resources. An example, a patient can come to me, have a problem with the low back pain. I can treat, I can say, oh, yes, it's going to be super good with the osteopathic treatment, because actually we have guidelines saying that actually is effective. Yes. So the patient doesn't respond. Now, if we have the idea of looking with the person-centered condition with evidence-informed practice mindset, certainly we need to know which are the other professionals and other methodology and other approaches that, in addition to osteopathic treatment, might be useful to suggest to the patient in order to improve his or her clinical condition. So, and that of course is patient focused. So the way forward, we need to have a clear understanding of the nature of osteopathy use and as well as the characteristics of users. So the osteopaths who are using that and how we can use that, because actually having a clear expectations of what can be researched and what actually from where actually we started definitely might open and broaden different perspective, but with the idea that rather than focusing always on the same conditions, that actually seems to be always those, the probability of having or the interest that we might have to explore different clinical conditions that actually from showed uh, um, clear, evidence of clinical evidence of improvements. So probably from taking the idea from the insights from the clinical side might also help to broaden the possibilities of testing new areas of interest. Otherwise, we fell into the trap of keep looking at the musculoskeletal problem. Of course, for the user, there are several projects, including one of the camp collaboration, that is the Opera project, where actually there is it's a survey, a census for identifying and featuring the different osteopaths in we started in Europe, and now we are also doing that in Canada, Brazil, and other countries are coming. So that creates the way forward for an interprofessional healthcare that is not related to the fact that the osteopathy is the panacea of every illness and of every problem, but needs to be contextualized into a modification of the healthcare system, because in the last 10 years has been significantly changed, both in terms of attitude of the healthcare, both in terms of the vision of the healthcare, and also in terms of how the healthcare is seen by the policymakers, stakeholders, and operators, so professionals and patients. Regarding policymakers and funding bodies, of course, the first element has been always the same. So the patient safety, health economics, and cost effectiveness of osteopathic research seems to be an element of extremely interest, in particular in this moment where the healthcare system actually are based on money. So, and where when actually there are the need for cutting from different governmental policies, what actually has been cut definitely is the healthcare. So we need to have an idea of what actually is the health economics and the cost, and how we can use the different elements of the health economics, so cost effectiveness, cost utility, and as elements for interfacing with the public sector and the policymakers. And the value and the relevance of osteopathy in clinical healthcare will not just related to the musculoskeletal condition, but also broadening the idea regarding other different conditions. There actually are the elements of value that might create the step forward in order to create possible associations with also other bodies, in particular, for example, with the insurance company. So broaden the research agenda to conduct several complementing healthcare research system research programs. It's definitely a priority, and it's essential to explore the range of potential facilitators and barrier of the scope of practice and the practice of osteopathy as within the health service. So thank you for your attention, and I'm very pleased to welcome any question or doubts or concerns.